Hi, dear friends. I just wanted to briefly introduce the topic of COVID and how to take care of it from home. I know things are getting out of control in the north of India and have requests from there, especially to help them figure out how to take care of things when they are home and the resources are scarce. Please keep in mind that the symptoms, there are different types of symptoms ranging from body aches, fevers, muscle pains, eye itching, eye redness, sore throat, dry cough, wet cough, allergy, muscle pain, muscle tremors, gastric upset, nausea, vomiting can be a wide ranging symptoms. Especially when the number of patients in our society is rising, the symptoms or the plethora of symptoms are also rising. So do not underestimate any ill feeling that you're having during this pandemic season. Consider that as COVID for now. If you have access to testing, please do get tested because knowing is power. But at the same time, if you do not have access to testing, then assume that it is COVID. Please, for mild, moderate illness, symptom care is more than sufficient, which means if you have fever, take paracetamol round the clock. If you have body ache, take paracetamol round the clock. You can take up to 3 to 4 grams of paracetamol a day safely if you don't have kidney disease or liver disease. If you have liver disease, you can take up to 2 grams per day of paracetamol safely. If you have vomiting, you can take anti-nausea, anti-vomiting pills. If you have diarrhea, you can take pills that will help stop the diarrhea. Stay hydrated, keep your temperature down. One of the most important gadgets or tools that you should have readily available is a pulse oximeter. Monitor your oxygen levels from the beginning, at least twice a day, keep a diary of it. If your oxygen levels are dropping, for instance, if you started at 97 and about 4 days later, if you're looking at 95, just be cautious. If you dip down to 94 the next day, go to a hospital. Uh, if you actually have drop in oxygen levels when you exert yourself, that is a warning sign. When all of these warning signs happen after the initial few days of symptoms, that is, if your day of onset of symptom is day one, and even after 5 or 6 or 7 days, you still have a lot of respiratory problems like cough or difficulty breathing, along with drop in oxygen levels on the oximeter, then it's time to be cautious and talk to a doctor. The doctor may consider giving you steroids. Do not self medicate. Talk to a doctor. You can do this from home itself. You can take home therapy. Only if your oxygen level drops less than 92%, or if your symptoms are overwhelmingly challenging that you can't breathe normally, then you should go to a hospital and require care in the hospital. For most other things, I think you can take care of yourself at home, manage things symptomatically, and you'll get better. Overwhelmingly, COVID infection is a self-limiting, self-restricting illness. 99% of patients do get better on their own. Out of the rest, 1%, majority of them require mild to moderate therapy. Some, unfortunately, require oxygen and ventilator beds. My goal is for you to prevent to get to that stage where you need such therapy. How can you do that? By keep a close monitor of your oxygen levels, by keeping a close monitor of your symptoms after about the initial 5, 6, 7, 8 days of your symptoms. If you have questions, please get in touch with one of the teleconsultation numbers that may be there in your city. You should be fine. Stay hydrated. Treat your symptoms. Most of the medications that we use these days are not really very effective against the viral illness, but some of it may be helpful if you have uh, a bacterial illness along with the viral illness. For instance, an antibiotic called azithromycin. If you have cough and the doctor thinks you have a consequent bacterial pneumonia, then it may help. Otherwise, hydroxychloroquine, ivermectin, um, uh, favipiravir initially, all of these are not very useful drugs. The only thing that is useful is for symptom-driven care. Whatever symptoms you have, take care of that. If after the initial 5 or 6 days of symptoms, you are continuously having respiratory problems, lung-related problems, make sure you get attention. Keep an oxymeter and monitor your oxygen levels from day one itself. If it's constantly dipping, that's a warning sign. I don't want you to wait until it gets to 92%. Seek attention if it drips steadily or if it drops with exertion. All right. I hope this helps you wherever you are. May God bless you and get you out of this pandemic, all you and your family safe and secure. Take care and God bless.